Hi guys, welcome back to my channel. So today I'm going to read an article entitled How Prescription Drug Negotiations Will Impact Medicare Beneficiaries. The Inflation Reduction Act or IRA of 2022 is legislation that significantly impacts Americans in different ways. While the legislation aims to reduce the impact of inflation and address energy issues, it also includes provisions to lower prescription drug costs, especially for those on Medicare. Among its key provisions affecting drug costs, the IRA will allow the government to negotiate the price of certain high-cost prescription drugs, making them more accessible for millions of Medicare recipients. Key takeaways: the Inflation Reduction Act or IRA of 2022 allows Medicare to negotiate drug prices for the first time in history. Medicare will follow a past plan to negotiate 10 to 20 high-cost drugs per year starting in 2026. Drugs will meet a maximum fair price. Only those using Medicare Part D will be eligible for the reduced prices. So what is the Inflation Reduction Act or IRA of 2022? The Inflation Reduction Act of IRA of 2022 is legislation that was signed into law by President Biden on August 2022. It is a scaled-down version of the Build Back Better Act. While there were significant cuts to the Build Back Better Act, many of the proposed issues were addressed, including investing in clean energy, eliminating tax loopholes, reducing the deficit, and lowering healthcare costs, including prescription drugs. How does the IRA reduce prescription drug costs? Prescription drug coverage is only included in Medicare Part D or some Medicare Advantage plans. Medicare Part D was first introduced as part of the Medicare Prescription Drug Improvement and Modernization Act of 2003, or MMA. The programs were intended to lower drug costs by providing coverage for certain prescriptions. However, the original bill included a provision that prohibited the federal government from negotiating drug prices with pharmaceutical companies. The Inflation Reduction Act changed that. Now the U.S. Secretary of Health and Human Services will have the authority and obligation to negotiate prices on a set of number of medication. The drugs up for price negotiation will be high-cost medication with no generic or biosimilar available. They also must be at least 9 years part of U.S. Food and Drug Administration of FDA approval for small molecule drugs or 13 years for biologic. The U.S. Secretary of Health and Human Services will work from a list of the 50 most expensive drugs that meet the requirement. Those medications are often used to treat cancer, rheumatic arthritis, and diabetes. Are you required to have Medicare Part D? No, you are not required to have Medicare Part D. Medicare Part D is an option plan that only covers prescription medication. Some medication may be covered under Medicare Part B, but they are typically drugs that would be administered via durable medical equipment such as a nebulizer or infusion pump. Most other medications fall under Medicare Part D. When will prescription drugs costs fall? Some provisions in the Inflation Reduction Act that lower the cost of prescription drug costs, such as a cap of insulin costs tax event in 2023, rebates the cost exceeding inflation will begin in 2023. Drug negotiations for certain high-cost drugs won't take effect until 2026. The bottom line: the Inflation Reduction of IRA has the potential to significantly lower drug prices for those who need it more, but relief will not come immediately. Negotiation on prices won't begin until 2026, and only the most expensive drugs will no generic or biosimilar will be considered. In the meantime, a cut of insulin costs start in 2023. So that's all the article. Bye bye and see you on my next video.